Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I'm chatting today with Dr. Anya Kleinman. And Anya is here for the Gold Lactation online conference. She will be presenting. Welcome, Anya. It's so good to have you here.
Thank you so much, Kristen. I'm so glad to join you.
And your presentation is titled Motivational Interviewing in Breastfeeding Care. Oh, I'm so excited about that topic. Really, I can't wait. But before we jump into this, I would like to know a little bit more about you. You're a pediatrician, right?
Yeah, I'm a pediatrician and I work in a pediatric emergency room in Northeast Ohio.
And
I've been
that's,
working there. Yeah, I've been working there
yeah.
for about 6 years and I love it.
Oh, and it sounds like a very busy place to work, right?
It is a busy place, but it's a great opportunity to meet children of all ages, from very young babies to teenagers. So it's something I really enjoy.
And you're into breastfeeding, of course. That as well. That's a very big love of yours, right?
Yes, no, I love interacting with children in all different dimensions, and the emergency room actually enables me to participate in lactation care for brand new babies, but it also gives me a chance to pursue my passion for early childhood literacy. So during COVID and now ongoing, we were able to start a book bank in the emergency room to share that love of books with our patients.
Oh, that's so beautiful. I love hearing about that. That's so nice. And what a beautiful idea in the emergency room because, usually that's a place where, it's not a place anybody looks forward to going, right? Especially for babies or little children. And so that's a beautiful thing to offer there. So thank you for sharing that here.
Yeah, for sure.
So let's talk about motivational interviewing. And you are quite an expert in it. This is motivational interviewing in breastfeeding care. Tell me a little bit, what is motivational interviewing? What do we hear that a lot recently in recent years, but what does it really mean?
That's a great question. So, motivational interviewing is a way for patients and providers, whether they're clinicians or nutritionists or therapists or anybody who's engaging in the care of other of their clients, to really figure out what's driving human behavior and to help people be their best selves through navigating a conversation that would otherwise sometimes be challenging.
And I can imagine if I think of motivational interviewing, I feel like also it can be very empowering, right? For the client, the patient we're working with, because let's face it, often, and this is how we were trained originally too, is like share a lot of information, right? I include myself fully into that. I love to give information, I love to educate about, but sometimes I need to step back and look at what I'm doing because just blurting out information, that's not enough, right? We need to be really seeing what's going on and how we can get the best information from our clients of what they need from us and what they're hoping for, and kind of empower them and involve them as partners rather than talking at them, talking with them, right?
Exactly. It's almost like transitioning from the role of lecturer or information giver to coaching, and trying to help the person achieve the goals that they have for themselves and to be much more neutral and detached from what they must or should do. So it's a lot less provider centered and a lot more patient centered, of helping walking with them in meeting their own goals wherever those might be. And ultimately, we find that it's much more rewarding for the clinician as well, because many people, when they are motivated by their own drives, when the client is driving the car, they get to where they want to get to much faster than if you are telling them where to go. And so you see better results, but also it's not you in the center of the story, but really the client, figuring out what's best for them.
You said so many great things right there, like putting the client in the center. It's client centered and not provider centered. And I love what you mentioned there about the coaching, coaching instead of lecturing or just providing information. I absolutely love that. So what would you say are some key principles of motivational interviewing?
That's a great question. So we'll talk about it at greater length in the lecture, but it's really important to facilitate a conversation where the client is empowered and feels not judged, but
Mhm.
rather motivated and driven to really understand for themselves what are the things that are most important for them, and to really feel, to create conversations where they themselves are stating their own goals instead of talking back at you about why they can't do the things that you're telling them they should do. And so really reframing the drivers for change.
Reframing the drivers for change. I love that. And also something that you said about like being a little bit more detached. Sometimes that is really difficult though, right? Because as in lactation care and when it comes to mothers and babies, we are in this kind of profession because we're passionate, right? And we have our own we want everybody to be able to have a great breastfeeding experience, every baby to enjoy that and have that. But so we have to, our own passion and our own opinion is not really what this is about, right?
Exactly. And it's very hard to leave that ego or that drive of our own in outside of the room, or at least to turn the volume down on that you should and you will kind of language, and really to understand how what are the things that the patient or the client wants to do and what's most important for them.
Absolutely. And you talked about this a little earlier too. And, outside of this recording, it is a skill, right? It is a learned skill. And so how can IBCLCs or anybody really practice that?
For sure. No, that's a great question. So I would say just it's almost like learning a different language in the same way that as you become more fluent in a language, you can carry on different conversations in different venues. You learn how to say your name and then you can
Mhm.
order food from a menu. Same thing with motivational interviewing. And so even in small moments in our clinical practice, we can try it out by asking open-ended questions or trying to understand how we can affirm or empower our patients. And then as it becomes more and more learned and we feel more and more comfortable, we can begin to have more challenging conversations with patients using this skill set.
Absolutely. I absolutely love that. And in your presentation, you're even giving us cases that you will be discussing, and our viewers will have a chance to kind of participate in that, right?
Exactly.
Go
Yeah,
ahead.
and I hope we'll learn from each other because everyone brings something to the table, and many people come to the conference with decades of experience in their own ways of speaking to patients that they've learned and honed and perfected.
Absolutely. I love that what you said, learning from each other. And there might be also cultural differences, right? Depending on where you are in the world, what is there in practice, maybe some areas are a little bit more formal and others more relaxed, depending on where you are. And so everybody can take that information that you will be providing and adapt that to their, practical setting.
Definitely.
Absolutely. So before I let you go, Anya, what are you hoping our viewers will take away from this presentation?
So I'm hoping that this conversation will be the beginning of many conversations about how we can best motivate our patients to feel empowered and to feel in control of their goals in lactation, and from there to continue to meet their own expectations for themselves. And I hope too that through the practice of motivational interviewing, our providers will feel more inspired in what they do day to day because it really does make the practice more rewarding.
I love that. Make the practice more rewarding. I think we all love that, right? Like, thank you so much for being here with me, Dr. Anya Kleinman. It was such a pleasure having you here today.
Thank you so much. Thank you.
And now some information for our viewers. The presentation Motivational Interviewing in Breastfeeding Care is part of our Gold Lactation online conference of 2025. We got started just around the corner here, beginning of April, and we have keynote presentations available for you that are open access and free of charge. So we invite you also go to goldlactation.com to sign up for these free keynotes, share those with your friends and colleagues, and of course, check out the conference. And I hope to see everyone in the conference. Thank you all for watching. Bye bye, everyone.